Hello, we are the group 5 and let's just assume that we are in hospital settings, so there would be protocols and guidelines that we need to follow, such as wearing of mask, proper social distancing, and wearing of gloves when interacting with a patient. Now we are going to demonstrate how to collect specimen for blood, urine, and saliva. Just keep on watching.
Good day everyone, I am your nurse for today and I'm going to demonstrate how to collect blood specimen using manufacture method. So the first thing we need to do is to advise or say to the patient what are the procedures we are going to do. So, sir, good morning. I am your nurse for today and the procedure that we are going to do is to extract your blood so we can have samples for it. And after doing that, make sure that before touching the patient, you must have a clean hands, properly washed and sanitized. So, before we start, we need to prepare the materials needed. So, here are the materials. This is the tourniquet. And assuming that this is an EDTA tube, syringe, sterile gloves, an alcohol, cotton balls, and the tape.
Now, the first thing that you need to do is to wet your hands with water. Get a soap and lather it into your hands. Now, rub your palm and also the back of your hands. Make sure to not forget to interlace your fingers at the back and also in the front. Now, rub your fingers at the back with your fingers interlocked and vice versa. The tip of your fingers, the thumb, and don't forget your wrist. Now, this procedure will run for 30 to 60 seconds and you are now ready to rinse your hands with running water. Now, dry your hands with a towel. And that is how you properly wash your hands. Before starting with the procedure, make sure to note the name and the age of the patient to know if he is the correct person that you are going to extract blood with. Now, also ask him if he has any allergic reaction specifically to latex gloves, or does he ever fainted when being extracted by blood, and if he has any fear of needles, to know the precautions that you are going to follow when doing the procedure. Now, let's proceed to the actual procedure.
After washing your hands, you are going to put on gloves. After washing my hands, I have put on my gloves. The next, I'm going to put the tourniquet around the patient's arm.
This will control the venous and it will be easier for you to locate the vein of the patient.
Then I'm going to ask the patient to make a fist. By palpating the patient's vein, I am going to know where the location I will be injecting the syringe. I will untie the tourniquet so as not to restrict the patient's blood flow. In a circular motion going outward, I am going to clean the area where I will be injecting the syringe. Now again, I'm going to tie the tourniquet around the patient's arm. Now, I'm going to ask the client again to make a fist as I palpate again the patient's vein. I am now going to open the needle.
Since there is no any available registered nurse or any medical technologies around us, we are going to assume that to use this syringe. First, twist the lid for it to be closed. Now I'm going to insert the needle onto the patient's vein.
Use thumb to draw skin tight about 1 to 2 below the manufacturer's side. And when inserting the needle, it must be bevel side up in 15° into the vein. Now slowly pull the plunger. Release tourniquet, and after opening the patient's hand, place dry gauze over the manufacturer's site and slowly remove the needle. Apply mild pressure to the pad.
Assuming that this is an EDTA tube, I'm going to transfer the specimen on the container. Make sure that the container and the syringe is tilted. Now I'm going to close the container so to avoid any contamination onto the specimen. You are now going to put the EDTA tube into a rack ready for the medical technologies for examination.
Here are the materials needed: straw, cup tube, and clear bag. Make sure the collection tube has your name, date of birth, and collection date. An hour before the procedure, let client drink water, and 30 minutes before the procedure, instruct her not to eat, drink, smoke, and vape. Wash your hand with soap and water, or you could use alcohol. Unscrew the cap of the tube and place the cup upside down. Here, the client used a sterile straw and put it in the container. Begin by allowing saliva to pool inside of your mouth. Massage cheek to produce saliva. Tightly screw the container. Use tissue to wipe away any rinse that touch the outside of the tube. Pass the tube to the personnel. The nurse will take the collected sample and put it in a bag where the form will be put.
Okay, here are the materials needed in getting a urine specimen. First is the cotton balls and a wipes. These are used to clean the genital area. Next one is a container for the urine specimen. And lastly is the running water. Running water can be used to clean the genital area and after the client getting a urine specimen.
Hello, so today I will be demonstrating to you how to instruct a patient on how to collect a urine specimen for routine urinalysis. So first we have to clarify to the patient her name and her DOB and her physician's request for a urinalysis. Hello ma'am, are you Miss Jingdo? And this is your date of birth, right?
Yes.
And this is your doctor's John Doe's request for a urinalysis, right? Okay, so I will be instructing you on how to collect your urine for urinalysis. Will that be okay for you?
Yes, ma'am.
Okay. Now, after I got her consent, I will now be instructing her how to collect a urine sample. Okay, so this is how you collect your urine. First, you have to wash your hands to make sure that it's clean. And then you're going to take 3 wet wipes. And then you're going to wipe each side of your genitalia. First, you're going to get the first wet tissue, and then you're going to take your index finger and your middle finger and then open your labia like this, and then you're going to wipe one side from front to back And then you're going to discard this, get another wet wipe, and then wipe the other side from front to back, and then discard, and then get a third one to wipe the center. And then without touching the center, get your cup and make sure to not touch the inside of the cup as well. Like that. And then you're just going to urinate in the cup midstream. So first you urinate and then you stop in the middle and then pee in the cup, on the cup, and then you continue in the toilet. And then I'm going to submit this to the laboratory for testing. Thank you.
First things first, I'm going to instruct the patient to collect a urine specimen. Hello, Sean. I'm your student nurse for today, Reginald Elegado. I would like to collect a urine specimen. Would that be okay?
Yes.
Naman. Natuloy ka ba?
Yes.
Yes. Okay. First, instruct the client to thoroughly clean the perineal area. In here, cleaning the perineal area could prevent any contamination on the urine specimen that would be going to get. After that, I'm going to instruct the client to open the container. Make sure the client doesn't touch the inner part of the container so that to prevent contamination on the urinal specimen. And then, I'm going to have the client urinate. Make sure the client put the container midway after urinating. Thank you. And that is how you collect a urinal specimen for a male patient. And now we're ready for examination.